All states and territories will be open by Christmas except for Western Australia. That's what was agreed to at today's National Cabinet meeting as the country charts a course back to relative normality. Leaders have also locked in a plan for immunising the country once a COVID-19 vaccine is proven safe and successful. Political reporter Matthew Doran is at Parliament House for us. Matthew, what movement is there on borders?
Well, Karina, it seems like an age ago that we were first talking about the framework to reopen the country as coronavirus started to ease. That was derailed, of course, because of what happened in Victoria with that second wave of infections and because WA had maintained its stance on having a hard border, not letting anyone into that state without some very strict controls there. But as we are starting to see the situation ease, or many cases in many states not actually recording any new coronavirus cases at all, particularly in Melbourne, which has been the concern for such a long time. We are seeing the states and territories, apart from WA, coming together and finally agreeing on this proposal. It has been an incremental shift. Most states and territories were already on board. Today has taken that one step further, but WA is still the holdout there. It does need to be pointed out that WA is reopening its borders, loosening some of those controls for some parts of the country, just not all of them just yet. This time frame of Christmas has been welcomed by the business sector, by many people around the country who've been separated from their families and friends for much of the year, and goes to restoring Australia to some sort of normality after this very bizarre year that we call 2020. On the issue of borders, though, while we might be talking about internal borders coming down, international borders, it looks like, will be staying closed for some time to come, with only Australian citizens and permanent residents allowed back into the country and going through those hotel quarantine facilities and other quarantine facilities such as the Howard Springs camp in the Northern Territory. That might be bad news for international students and the universities that are reliant on those borders, those border restrictions being eased, but the Prime Minister says that the situation around the world is deteriorating. Those figures coming out of North America and out of Europe are incredibly troubling, and to start trying to allow anyone other than Australian citizens into the country at this time is simply too difficult. They do need to be given priority, given that there are some 35,000, close to 36,000 Australians still on that list waiting to come back into the country. Here's the Prime Minister earlier.
This is a question of priorities, and our priorities must be to look after Australian citizens and residents first. Now, because of the deteriorating situation in other parts of the world, we are seeing more Australians even than a couple of months ago seeking to come back. More Australians who may be finishing off work contracts or studies or other arrangements they've had over the course of the year and now registering and looking to come back. And so they are difficult choices. Of course, we would like to see so many parts of our economy return to normal, but we must ensure that we put Australians first in that task.
Matthew, what have we learnt about how a COVID-19 vaccine would be rolled out across the country?
Well, the states and territories have agreed to a few guidelines here. First of all, there are going to be 3 priority groups of Australians who will effectively be at the front of the queue when a successful COVID-19 vaccine is found and is able to be distributed across the country. They include frontline healthcare and aged care workers who are more likely to be exposed to COVID-19 just because of their work. The second group are older Australians and Indigenous Australians, as well as those who have pre-existing medical conditions, because they too are more vulnerable to COVID-19. The third group are those working in critical sectors, because the governments around Australia have decided that there is a need to safeguard those sectors to ensure that the country can keep ticking over. Now, this might seem slightly presumptuous when we haven't actually got to a stage where there is a successful coronavirus vaccine yet. Australia has 4 supply deals for 4 different vaccines around the country, and we heard today, or around the world rather, and we heard today that the one that is being developed by the University of Queensland is starting to show some promising results. When one of those vaccines does go into distribution around the country, we are already hearing that there will be a register set up so that people can be monitored as to who actually has that vaccine. That register helping authorities keep a check on how COVID-19 is travelling around the country, if indeed at all. There will also have to be an education campaign talking about the merits of such a vaccine and trying to combat some of the disinformation that exists, particularly on social media, about vaccinations. The Acting Chief Medical Officer, Paul Kelly, says this is an incredibly important step in preparing the country for a life in the post-COVID era, and that while there is some caution about how developed some of these vaccination trials are, there is also optimism that we could start seeing one being rolled out from March next year.
There are no shortcuts to this. It's going fast, that's true, but all of the processes for regulation will be there. All of the systems to make sure that we're certain about safety, and if anything happened that we would know about it and be able to deal with it quickly. And people will be very much encouraged, and I'm sure there'll be a lot of people that will be queuing up for this vaccine.
The message coming from federal health authorities is also not to be complacent at the moment. Just because we are seeing very low numbers of coronavirus cases in Australia and there is this hope that a vaccine is just over the horizon, it doesn't mean that Australians should be any less vigilant than they have been over the past weeks and months. Karina?
Matthew Doran reporting from Canberra.